healing hands are not always those of doctors. It's a chilly morning in 15th century France. You head to the barber, expecting a shave and a trim. As you approach, the sound of cheerful singing greets you, accompanied by an unsettling sight: a bowl of blood prominently displayed in the window. Inside, both barber chairs are occupied. You grab a cup of ale and notice the peculiar decorations, rows of teeth strung up like trophies on the walls. Suddenly, a piercing scream shatters the air. The barber's apprentice methodically wipes pus from a freshly lanced boil. In the other chair, the barber leans over a patient, gripping a pair of pliers tightly around a decayed, blackened tooth. For centuries in Europe, barbers were far more than hairdressers. These craftsmen doubled as surgeons, performing a wide array of procedures, from pulling teeth to stitching wounds and even amputations. But how did they come to take on such grim responsibilities? The answer lies in the shifting roles within the church and the medical field. Before barbers took on surgical duties, these tasks were often performed by monks. Monasteries, where clergy adhered to strict grooming standards like shaved tonsures and clean-shaven faces, always kept a barber on hand. These barbers, already skilled with sharp instruments, were naturally recruited to assist with surgical procedures. However, in 1215, the Catholic Church forbade clergy from engaging in any activities that deliberately spilled blood. Around the same time, universities began opening medical schools, creating a new class of academic doctors. These scholars, priding themselves on intellectual pursuits, refused to sully their hands with surgical work. This divide created two distinct disciplines: medicine, focused on diagnosis and theory, and surgery, grounded in hands-on practice. The role of performing surgeries fell to barbers, who became barber-surgeons. Rather than attending universities, barber-surgeons learned their craft through apprenticeships, blending practical anatomy with elements of astrology. They believed the alignment of celestial bodies influenced health, factoring lunar phases and star positions into their treatments. To retain essential knowledge, barber-surgeons often memorized instructional rhymes such as verses identifying which body parts were best for bloodletting, temples for headaches, the right hand pinky for liver issues, and the back of the legs for hemorrhoids. Barber-surgeons had their hands full. The 14th century Little Ice Age caused erratic weather, leading to famines across Europe. Many turned to eating rye flour contaminated with ergot fungus, resulting in illnesses that sometimes progressed to gangrene. In these cases, barbers would amputate affected limbs, covering the stumps with animal bladders to aid healing. Their services extended beyond their shops. Barber surgeons often accompanied armies, addressing both battlefield injuries and grooming needs. Over time, they even contributed to medical advancements. One notable barber surgeon, Ambroise Paré, revolutionized battlefield medicine in the 16th century. He rejected the brutal practice of pouring boiling oil into gunshot wounds, advocating instead for a soothing antiseptic salve made from egg yolks, rosewater, and turpentine. This approach became the standard for treating such injuries across Europe. By the 18th century, medical science was evolving rapidly. Advances in surgical techniques allowed for better wound closure, blood loss management, and intricate procedures like tumor removal. These developments placed surgery on a more specialized path, ultimately leading to the separation of barbers and surgeons into distinct professions. Surgeons and dentists became part of the educated medical elite, while barbers remained skilled craftsmen, learning through apprenticeships. Today, the barber surgeon's legacy persists, most notably in the iconic red and white barber pole. According to legend, the pole's stripes symbolize the blood and bandages of their storied past. For more videos, please like and subscribe.